Where the responsibility of government, our nation and the community has their own role. We should obey the order of the medical personnel that we should, if there is a lockdown, there must be the reason for the lockdown. If we are saying you put the mask there, there must be reason for that one. So we must keep the good type of mask, which is minimum 3-ply, so that the virus, if it is there in our area, it should not cross to our body and to the breathing system. So your question of this one, whether the government should do more about this one or not, well, there is always room to do a little bit more. So we should provide, number one, that maximum medical facilities, number one. Number two, those who are not unable to earn during that time, if there is a possibility to support by the government and by the community to have a respectable, at least comfortable life during the lockdown period.
Okay. In terms of the COVID-19 test, do you have the PCR or the anti-aging tests available in Zimbabwe?
Both we have. And there are many laboratories who are doing this COVID test, which is rapid test, which we can get it. But that is not a gold standard. That if somebody is harboring the virus into the nose, the COVID test, the rapid COVID test may not be positive, but in case of PCR, it will be definitely positive.
Okay, and are the results available within 72 hours?
That is right. The rapid test we can get within 30 minutes time, less than 30 minutes time. But the PCR, it all depends on the laboratories, what type of equipment they have, what type of facilities they are providing, they can do. There are some laboratories which give the result immediately, or there are some laboratories take about 24 to 48 hours.
Okay, thank you. But in terms of the lockdown, the industry has been opened with a close adherence to the World Health Organization's, the best practice that we're having here in Zimbabwe. Do you think that as a country we should have our own regulations which are not according to the World Health Organization?
You know, your question is that whether we should have our own regulation,
yes,
or we follow the international regulation.
Yes.
Every country has its own regulation. If the incidence of more, as nowadays the incidence in Brazil is more of the COVID, there may be some other more strict regulation over there than the country in Zimbabwe, where the incidence is coming down. The death rate is, for last few days, we do not have recorded any death, though the new cases come up, so we should be careful. So three things these things are very important. Number one, mask is important to protect ourselves. Number two is the washing of the hand regularly. Number three, that we should have this one, keep safe distance, 1 meter from you, 1 meter from us. So if there is keep safe distance, that we are well protected. So the mask, washing the hand, and the safe distance is a gold standard of prevention of COVID-19.
Okay. In terms of mask wearing and social distancing, there's this thought that there isn't much of a difference whether one wears a mask or not. Is it true?
the distance we should do, that the distance we should keep it from one person to the other, that we should keep a distance, and the mask again is very important. And please do not touch your nose, mouth and eyes unnecessarily.
Okay. Right now the government allowed intercity travels and interprovincial travels. People can now travel within the country. What's your take as a medical practitioner in terms of this pandemic?
For the intercity, I think if the incidence is a bit low, then there is no problem of intercity traveling. Only those, because last time in December we have a surge of COVID because there are a lot of people coming from the South Africa to Zimbabwe for the holidays, and our incidence of that one went very high, and we went to the lockdown of grade stage 4. So at the present moment, if we are doing this traveling, so fair enough we can do the traveling according to the regulation of the government.
According to the regulation, okay. But right now, international travel is still permitted, considering that one is tested. Can we say that we are safe, considering that there is a new strain that has been detected across South African border?
Well, you know, the strain mutation of the virus, we are seeing that one, that off and on. There are the new strains are coming in different countries. So we should consider that one, those new strains, that we should be careful, and we are giving the vaccine now, Sinopharm, and there is another Indian vaccination is coming. So I am sure that we can be protected through this, with the vaccine. And please, I got the jab of vaccine. This is a misnomer. There is a rumors, and please do not listen to that one, that this vaccine can give rise to any problem, either impotency or any problem of that one. So we should be careful, and we should be, as a nation, our duty is that we should all get the vaccination according to the standard provided by the government.
As the country is preparing to open schools and universities, what kind of advice would you give the government to put in place to protect the kids in schools?
Well, it all depends on the number of cases we can see of the COVID. But even now, when there is a low police block, we should keep the mask in wherever we are traveling, number one. And they say that the maximum 50 students should be in a class, or there may be no much gathering or any supporting a sports activity they are not permitting, and there are some other assembly points they are not allowing them. So these things we must take care of that. We should keep those standard what the medical personnel of our country, they are saying that one, that put the mask, keep the distance, wash your hand, don't touch your nose and eyes and mouth unnecessarily.
Okay. What's your last take on the COVID-19 subject in total?
Sorry, say it again.
What's your last take on the subject?
Again, I say that prevention is better than cure. And please, every flu is not a COVID, and we should have, if somebody is having the problem of a dry cough, fever, general body pain and tiredness. These are the three or four things which come very commonly. So if somebody is thinking about that one, we should go for the COVID test. Again, when they have more problems like difficulty in breathing, that is the most severe case, or tightness of the chest, and that is the problem where we should be considered probably that we should keep ourselves attend to the doctor, number one. If there is a mild sign and symptom, the best thing is stay at home, good rest, and a lot of fluid and good food. That is, most of the time people recover from that one. If they have, and that if you are in a room, do not overcrowd the room, number one, and must be good ventilation. Open these windows properly so that the virus should go out with the flow of the wind. So important thing is that we should keep our immunity good, and we have good food, vitamin C in the form of orange, lemon, ginger, green or black tea. These are good things to take day and night during this pandemic. Right. The treatment, what is we have, this is a viral infection, they're all the supportive treatment. Supportive treatment means if somebody is having difficulty in breathing, he should take this hot water fumes and inhalation of that one. Again, he or she should lie down on supine position, and the rest. Aspirin is one of the good things that it will reduce the temperature, reduce the coagulation or reduce the thickening of the blood. We give some heparin or those tablets to reduce the clotting. Prednisolone is that for the inflammation, and the antibiotic to prevent any superadded infection. So these are the treatment, but there is no specific treatment for this COVID-19. So we have to prevent. Prevention is better than cure. So we must know that we should be careful. If somebody is having a sign and symptom, he or she should remain inside the house unless it's proved whether he or she has the COVID or not. Thank you very much.
Your name again and your...
My name is Dr. BILAAL SHAAH, medical practitioner in Harare.
Thank you, sir.